One. Good afternoon and welcome to the COVID-19 Financial Oversight Committee meeting for February 9th, 2022. Thank you all for being here. I do want to make just one introduction to a new face from Metro, and we have Wade McManus. She is a finance administrator who is working directly with me not only on our ARP funds, our final reporting with our CARES Act funds, and then also all of our other disasters and federal fund recovery we've had going on at Metro for the last 2 years. So I'm glad to have Wade on the team. You will see her face. You'll have emails from her. I'm very excited she's here. So we will dive into the agenda. We may have a little bit of an agenda change for our second item, kind of last minute, but doesn't impact our first one. So let's go ahead and start. We will come back to the survey in more detail. But what we did look at our January meeting, we had some interim results. And one of the highest items, one of the items with the most importance was access to childcare. And so based on that interim report, we discussed that we'd like to start on that topic right away. It might be a pretty in-depth topic. I don't know that we'll get to a point that we have all the information that you all want to make a recommendation, but we did. I wanted to thank Councilwoman Gamble, who did some outreach on that topic, identified a couple of the partners that could be here. So I'm actually going to invite, I don't know if you all want to do it at once. Let me just tell you who we have here. We have Erica Ward, who is the Director of Early Learning at the Rafa Institute. We have Apri Gassaway, the Director of Education, and Erica Mitchell, Executive Vice President and Chief Community Impact Officer from United Way. And we have Dr. Kroom, Dr. Cynthia Kroom, who's the Executive Director of our Metro Action Commission. So 3 organizations, including a Metro agency, that do quite a bit of work in this area. And what we want to do is lay the foundation for what are the current conditions, what are the issues that our families in Davidson County are facing, what are some of the short-term and long-term solutions, and which ones are a great opportunity for use of ARP funds. So I believe that I think that United Way and Rafa Institute are going to present together. Is that right? So if you guys want, you can, you can all come up here. If we need to share spaces, we can. Come on up. If you guys want to take these seats, I'll turn those mics on. Sometimes they're a little fidgety, but. How are you? I have one. I'm good. Yeah. Yep. I stole one for myself. Or at least I say that. You know what? I can't put my hands on mine. I will take one. Oh, no. I knew I had one. All right. Let me get your microphone there. Let's see. Apri, if you hit the stand on that one, it should turn it on.
Take it.
On there?
Is it? Testing 1, 2. It sounds like it's
Okay, I'm going to turn it over to you guys.
Thanks, Mary Jo. Good afternoon, everyone. Can everyone hear me? Okay. Okay, wonderful. Good afternoon, council members. My name is Apri Gassaway, as Mary Jo mentioned. I'm the Director of Education at United Way of Greater Nashville. United Way is mission to unite the community and mobilize resources so that every child, individual and family thrives. We've invested in early childhood education initiatives for many years, as many of you know. Our Read to Succeed program, Imagination Library of Middle Tennessee, and in most recent years, Blueprint for Early Childhood Success and Bright Start Tennessee. A combined local and statewide network of community partnerships dedicated to accelerate early learning outcomes and close achievement gaps and opportunity gaps for children birth through third grade in our city. Co-presenting with me today is Mr. Travis Claybrooks, who is the CEO of Refugee Institute, and Erica Ward, who is the Early Embrace Program Director, also at Refugee Institute. It is our pleasure to be here today with you this afternoon. Refugee's Early Embrace Child Care Network is piloting a support network for home-based child care providers who serve Nashville's low-income families. They will offer business coaching, education coaching, support with licensing, and more. And they will do this because, as many of you I'm sure will agree, investing in home-based child care providers is a critical component to advancing racial equity and economic justice in early childhood education. So again, thank you for the opportunity to look more broadly at child care as a much-needed area of investment in Nashville. Our presentation this afternoon will focus on why early childhood education matters, the current landscape or state of childcare in Nashville, and a proposed short-term investment structure to support our local child care industry. And please feel free, as you are already doing, reference the printouts of our slides. And with that, I will pass it to Travis, who will talk you through why early childhood education matters.
Thank you, Apri. Hello, everyone. Wait a minute now, I'm a preacher. I like you talk back to me now. Good afternoon, everyone. No, thank you. Thank you so much for allowing us to be here today. And I'm not really going to talk from the slides. I'm really just going to give you a little, just some story as to why. And I don't pretend to share with you something that you don't already know. But sometimes an exclamation point can be helpful. And I'm going to talk to you from the framework of Refugee Institute and how we landed really in this work in this space, and use that as a kind of a framing for the bigger picture that I think is important to us as a city, right? We programmatically cut our teeth in a restorative justice diversion program in juvenile court. Judge Calloway looked around and saw a great need, both for people who've been harmed by crime, but in particular, young people who are causing harm in community, right? Recognizing that the traditional criminal legal process really offers nothing by way of a transformative response or a transformational opportunity for young people who go through that system. Judge Calloway, along with General Funk, and then Public Defender Dawn Diener, and then Chief of Police Steve Anderson, really were all looking for some sort of alternative. We landed on restorative justice, and they asked our organization if we would consider leading a pilot program. Now, this was 2018. We took our first case way back then. Since then, we've had over 50 young people complete that restorative justice program. And what does that look like? It looks like instead of kids being prosecuted on cases, they go through a restorative justice process where they really come in space with the person who they've harmed to talk about the harm, the impact of that harm, and ways of repairing it, right? We've got about a 2% reconviction recidivism on kids who've completed the program. We've only had, out of almost 60 kids, we've only had 4 kids get rearrested in a 3.5 year period. What we began to observe over time, something that we already knew, but we now had the anecdotal proof, 100% of kids coming through that criminal legal process were facing 2 things. One, they were coming from an ecosystem where there were social determinants that almost were guaranteeing the path that they were on, right? They were coming from communities that had more than just problems around so-called crime, but there were economic challenges, there are housing challenges, there are education challenges, there are healthcare challenges, especially in the space of mental health care, and so forth. It was just this big constellation of stuff. One of the key challenges, though, that we began to see as we began to talk and actually go into homes, having conversations, all of these kids had poor early starts, especially in the early education space, right? They either had no access to high quality early learning, or if they had access to it, they couldn't afford it, or there was some other barrier like transportation, right? And so we began to see this, and we began to make a correlation to, what if we went 10, 15 years into the future? We're working with kids that are 12, 15, 17 years old. What if we went 15 years into the future and began to touch kids when they were prenatal, 3 months, 3 years old? Could we not only change the trajectory of those young people who were on a pipeline, given where they lived and given what the story was for their community, right? Could we not only work to change their trajectory, but could we also fundamentally change the ecosystem into which they were born, right? Could we fundamentally change the neighborhood by working through early learning? And my niece was who was in a graduate program at, a few years ago when I was, dreaming about this. She said, "You got to meet this woman who's in my class, Erica Ward. You got to meet her." And so Erica and I ended up meeting. We ended up talking and sharing vision around this. How do we fundamentally help communities to heal and at the same time position young people not only to stay away from the criminal legal system, but to have the kinds of experiences that lead to outcomes that make them contributors to society, that is going to tend towards them finishing high school, perhaps owning a home by the time they're age 30, going on to contribute economically to our community? Could we do that by working through the door of early learning? And we think the answer is yes. Erica's going to talk probably in more detail about what that looks like, but I do want to touch just a little bit on the frame of it, right? What we also observed was that there is already an infrastructure in these communities, right? I'm talking about an MDHA property, a low-income community, a marginalized community, right? You got aunties and neighbors that are already keeping kids, right? But the challenge is there is so much distance between them and the resources that they require to be, one, high quality centers of early education and economically viable centers of business in the community. And man, what if we could both and at the same time create a space where the kids are getting excellent learning next door and create a business, a viable, economically contributing business to a community that is desperate for economy, right? If we could do that both and at the same time, boy, we go a long way to changing and transforming those social determinants that have plagued our communities for years, for decades, right? So that's why Rafa Institute believes that early learning and working through the door of early learning and investing in early learning and in viable frameworks of early learning is so important. That's why we're in that business. That's why we got into that business from our own work in restorative justice and working with kids and seeing where they end up when nothing happens, right? That's why we're there. And we think that that's a good enough reason for our entire city to be thinking along these lines. And we know that you are, else you wouldn't be having us here today. So we're grateful for that. But I just wanted to tether that kind of narrative to what you're considering. I'm going to pass it to Erica to take it from here.
Thank you, Travis. So I can just give some more information about the childcare landscape in Davidson County. So childcare, when we think about childcare, of course, importantly, we have the children. But as Travis mentioned, you have the educators and you have the families. It's important to think about that childcare landscape really has to serve all of those people involved, right? And within that childcare landscape, an early childhood landscape, of course, we have Head Start, who is a leader in serving low-income children here in Nashville. We have Early Head Start as well. We have for-profit child care centers. We have nonprofit child care centers that operate from churches. And then you have what they call family, friend, and neighbor care, which is our area of focus with Early Embrace. Davidson County has over 44,000 children under the age of 5. And about 34% of those children live in families that are determined to be low income. So that's about 200% of the federal poverty line. Tennesseans for Quality Early Education did a parent survey, and they found that 70% of parents reported problems accessing suitable childcare that met their needs either financially or the hours of operation perhaps that they needed. Another area of focus is important is, again, 66% reported that they cannot afford childcare, high-quality childcare. And we know that impacts your ability to work, right? That impacts your, if you don't have childcare, how do you get to work? And then this other piece I think is important to mention is 33% of working parents have shift or kind of gig work. And that comes from the Chamber of Commerce. So it's important when we think about childcare, we're not only thinking about Monday through Friday, 9 to 5, but we recognize that our economy is a hospitality economy. We have amazing restaurants. We have all these great businesses that require childcare in non-traditional hours as well. And I will pass it to Apri, who will be on slide 4 or page 4 in discussing childcare deserts.
Thanks, Erica. And so as we think about exactly what Erica is highlighting in terms of just the variation of working structures that people have, families have, and then if you refer to slide 4, you can see when we look at childcare and then look at childcare as it relates to deserts in our city, and the rate of child poverty. So let's zoom in and look at Germantown, for example, 37208. The child poverty rate in that zip code is 67%. And the estimated population of children birth to age 4 is just over 1,000. But the number of available child care seats for children 6 weeks to age 4 is only 600, right? So it boils down to supply and demand, right? But then when you think about and overlay that with families, lower income earning households or families, there are so many other compounding issues that feed into this narrative, right? So sure, we can look at this slide and see by zip code and child poverty rate where the child care deserts are. But when you also look at transportation, right? So if I live in 37208 and I'm a lower income earning family, I may not have the resources to travel outside of that zip code to a neighboring zip code in search of childcare that is affordable, that is high quality, right? So this is the state of options for children and families that plays into their long-term success factors, really, when we think about education, when we think about health, when we think about the overall family structure and the health of that family structure and whether they're able to thrive and not just survive. Economics, all of those things play into when you look at the narrative and pull the thread. There's so many different factors that play into that. It's just not just a child care desert. There's so many other pieces that are connected to that are very challenging aspects to families that fit that profile. So one of the other things I do want to mention about that is when we think about child care and the incentive for providers to care for children from lower income earning households, there is none. There is no incentive, right? So you have your market rate for-profit centers. They charge what they charge, and the families that can afford to pay, they pay. When you talk about the other care options that Erica mentioned, like community-based child care providers, there is no incentive to serve lower income children. But a lot of these community-based child care centers or programs are missioned to do that. So they build in their model a way to serve lower income children. The challenge is they can't afford to do it. So their mission to do something that they can't afford to do. And when we look at the, and it's going back to the incentive, and that there is little to no incentive to do it, aside from an organization being missioned to do such. When you look at the cost of care, so the reimbursement rate, and we'll dig into a little bit of this more later, but when you look at the reimbursement rate that centers receive from the state to care for children and families on vouchers, but you also look at the cost of the actual cost of care, there's a discrepancy there. And so centers that do serve children, lower income children, there is a balance there. And who absorbs that? Centers. But the question is, how long can they continue to do that? They're not surviving much longer. And the pandemic has just exacerbated all the things that we have talked about up to this point. So Erica, I will kick it back to you. Actually, still me. So when we think about the impact, right? What is the impact of an insufficient investment in childcare? Well, there's an economic impact, right? TQE released a report that Erica mentioned earlier, and if you want to go look it up, if you haven't seen it already, which I'm sure many of you have, but Want to Grow Tennessee's Economy, Fix the Child Care Crisis. In that report, they cited a combined annual economic loss of $235 million combined for parents, businesses, and taxpayers due to insufficient child care. So there's a huge economic annual hit. Then you look at education, right? And we look at the third grade literacy proficiency rates of children in this city. It's 22%, but when you drill deeper, right, 13%, there's a 13% third grade literacy proficiency rate for economically disadvantaged children. So the same population of children we're talking about, right, that likely are in childcare deserts and had challenges when you think about transportation and accessing high quality childcare, being able to afford it when you get there. These are challenges, and we see the result of that when we look at third grade reading proficiency rates. And we cannot talk about high quality childcare, accessible childcare, and affordable childcare and not address the early educator workforce. Because there's no such thing as high quality childcare if you don't have a workforce. A, if you don't have a workforce, but certainly B, a workforce that's highly trained, right? So we can't really have this conversation about solution solving if we don't include that in the equation. And by way of a blueprint for early childhood success working group, as a result of that work, they conducted a survey which included focus groups, interviews, surveys, to really understand the early childhood educator story narrative. And as a result of that work, we discovered 64% of educators report that competitive pay outside the field and lack of career mobility significantly influence their decision to leave the profession. So at a significant rate, educators are saying, I've had enough. Like, I can't afford this profession. A lot of our early educators are on the same benefits that families that attend these community-based centers are serving. And if they choose to go work for Amazon, Target, Walmart, you get significantly more money, less workload, You have more autonomy and flexibility around your work schedule, right? There's just there's a list of just other options, fewer barriers and challenges and demands, quite frankly. It's a lot of work to care for children in a high quality way. And we're finding that for a lot of early childhood educators, the juice is simply not worth the squeeze. Yeah, sure, Trash.
I think it's important to overlay all of this with COVID being in a pandemic, right? So these realities are true in a normal world, but all of it is significantly and severely amplified in this pandemic environment. I mean, we know that there are inherent economic depressors related to living in a pandemic, right? They're there. They're natural. Certain people can't go to work. Some people have to go to work and then are exposed to, greater chance of disease. And that tends to be the people who have to go to work face to face with other people, right? The store, the restaurant, so forth and so on. So you overlay all of these naturally occurring dynamics in our city and many cities like ours, right? You overlay that with the amplifier of COVID, and it makes it worse for everybody, and especially for communities that are susceptible to the deleterious effects of being in a pandemic, which typically are people who are economically marginalized, people who don't have access to resources readily, like childcare, or I can take off, I can not go to work, I can work from home, I have the luxury of working from home, right? So I think that's important to consider this, especially in the context of why you are here, right? And the task that is before you. We are not talking about this in the absence of COVID, we are talking about this in the context of COVID. And if there is a place to invest from, it is from the resources that are seeking to solve issues that are related to COVID-19. So I just wanted to raise that to our frontal lobes.
I think, advancing to slide 8 or page 8, we have the opportunity now to actually start to think about a pathway forward, right? So COVID exposed so many of the challenges that our communities have been facing. And now we can really look at what does it look like to create a cycle of success as we move forward. We know that early child education is a critical component of that, but it has to operate within an ecosystem, right, that's supporting children and supporting families. One of the things that I always like to try to explain to people who want to invest in early childhood development is that there's not one solution, right? It's not as simple as we need more child care centers, right? We do need more child care centers. It's not as simple as pour all of the money into home-based child care providers. We need to invest in home-based child care providers. It's not as simple as saying expand MNPS pre-K or expand Head Start. You have to have all of those things working together and centered on that child and that family. Because from the vantage point of a family, we also work with mothers at Refugee Institute, and it's so hard to figure out where to go and where to get support. Where do I start? I work with moms every single day who struggle with that. So I think the amazing work that they're doing in a United Way with the blueprint, the Bright starts to say, we need to have a cohesive system, and we need to make sure that every piece of this system is being invested in. And so I think as we'll discuss some ideas for how we can move forward, how the city could make its first big investment in childcare, right? Our city has not invested in childcare at scale yet, and there's some great examples of what other cities are doing to do that with American Rescue Plan dollars. But as we think about that, I think it's really important to remember that it has to be a multifaceted solution. And Apri, do you want to take us to that last slide? So we have time for Q&A?
Yeah, sure. So as we consider, what do we do, right? Where do we start, right? What do we prioritize? What's low-hanging fruit? What are some quick wins? To then be thoughtful about the long-term game plan. A few things. If you look at the last slide, a short-term play is stabilization grants for a subset of center-based providers. So the beautiful thing about this collaboration here is United Way has historically partnered with and invested in center-based childcare. And RFA has tackled home-based, family-based, friends, family, neighbor-based care. And so we're trying to wrap our arms around all forms of care and really understand how can we accelerate what's working, innovate new ideas, scale to really serve. And I'll just say, I'm a parent of two, a middle-class family, and childcare is grossly expensive for me. Okay, so childcare is an issue for everyone with children, but we also have to know and understand that there is a population in our community, our lower income earners, where childcare is just impossible. I can't afford it, right? And so we have to focus our attention and our efforts there first to really support families, children in our community that are in highest need. Because while I, as a middle-class community member, I have more options, right? I can hire a nanny, or I can afford to drive across town to find an option for care. There are other families that don't have those options, and children take the brunt, they take the hit because of that family circumstance. And so our work is really honing in on our lowest income earning households and families. So there's an opportunity to really partner with up to 12 center-based providers. And with that funding, really look at picking up the tab, essentially, that community-based centers are picking up currently. When you think about the reimbursement rate that they receive from the state and the actual cost of care and what that gap is, we would leverage those funds to pick up the tab so that centers are not having to absorb the cost or take the hit. So that would be a short-term plan to help stabilize the industry, stand it back up, right? All of this is in an effort to stand the industry back up because it's on its knees right now. The second option is, Erica mentioned Blueprint for Early Childhood Success and Bright Start. Those are two collaborative efforts to really pull together cross-sector groups in the community, across health, across all forms, all industries, to really come together, because all of those aspects are really important when we are looking at a comprehensive picture of educating children, birth on through. It takes everyone. And so that work is really designed to pull collaborative partnerships and partners together to identify what those short-term and long-term strategies should be, having everyone speak into a plan for the city. Like when we think of a birth to 8 plan, the goal of that work is to produce a birth to 8 plan for children, to ensure at the end of it all that children are reading on grade level by 3rd grade, because we know that is a major mile marker and indicator for long-term success and livelihood for children. So if we can get that right, if we can get the birth to 8 space right, our chances for children thriving long term have significantly increased. And so part of what that second option there noted on the side, the planning grant, is to really invest in the infrastructure necessary to plan and figure out and develop the strategy, the long-term game plan and strategy for the city around childcare and how we want to invest in it to ensure that children are thriving. And then finally, and I'll ask Erica to speak into this, but a stabilization and startup grant for home-based care. The Refugee team knows better than most. That is an area of care that in some communities is most preferred. However, the infrastructure for a lot of providers in the home-based sector is just insufficient. It's even more insufficient than center-based care. And so really honing in on supporting providers in that space, because it could be the difference between a family being able to access childcare in their neighborhood because they're going next door to the home-based care versus trying to find the closest center-based care, right? It could be the difference between that family finding care that they can actually get to and them not finding care. So attacking this, and I like to call it an opportunity, but attacking this opportunity from both angles. Center-based care, because there are challenges there that look very different than challenges that home-based providers experience. And Erica, I don't know if you wanted to add anything to that.
Erica, just keep it real quick, because I know our committee's going to have some questions.
You guys
I would
can
like
jump
Dr.
into
Kroom-
questions.
I would like Dr. Kroom to come up.
No questions.
Yeah, this committee never asks questions. Dr. Cynthia Kroom is our Executive Director of Metro Action Commission, and some of you may be aware, but I wanted to make sure that we really put together all the pieces of the childcare, not just challenges, but also the opportunities. If you want, Dr. Kroom, you can come up here. That council mic. But there's a lot of programs that Metro is already investing in, and if you maybe can share some of the work that's being done by Metro in this space, and maybe some of the challenges and that your team's facing, and that funding might be able to impact that too. So that way we can kind of consider everything together when we do questions. Thank you for being here.
Hello, everyone. I hope this is on. You all did a wonderful job. I think they did a great job just really capturing what was there. Currently, you know, we administer both the early Head Start and Head Start, and that includes pregnant moms. So pregnant moms through children age 5. And what I heard here is absolutely true. We do not provide weekend care or nighttime care or any of the things that families need. And we are also limited in terms of the number of locations that we're able to serve. So believe it or not, I'm not actually up here to ask you to fund anything, but rather to be able to lend some support to whatever the thinking is and how I feel like we might interface with that. I generally wait for my funding request with the budget line items that Metro does for our organization, but really want to answer any questions that I could possibly answer that might lend some support to just the need to support childcare across the city, whether it's through our organization or through some of the home-based work that I've heard you all talk about, recognizing certainly the challenges that come with all of this. But that's really why I'm here.
Excellent.
Not to try and say, hey, what about us? But just to say, really, I'm here to help answer questions that might be helpful.
Another subject matter expert. Thank you. All right, we're going to open it up to the committee for questions. I see Councilwoman Sepulveda.
Thank you, and thank you guys for being here and presenting this to us. I have one question and then two things that I think we need to keep in mind. One is, what are the 12 providers? Who are they? And then two things that I think we need to keep in mind is making sure that we remember immigrant communities and the language barriers. And I've said this to MMPS when they've presented to us for budget. I think it's important to have bilingual caretakers and teachers and whatnot, because sometimes children over the years lose the language, their native language as well. And I think it would be great for not just immigrant and households, but when you look at other countries, they're already doing this. They're teaching their children multiple languages. So I think we need to keep that in mind. I also think that we need to keep in mind the way we, if this gets approved, whenever something concrete is presented to us, the way we let the community know. Because I think in many cases, minority communities and immigrant communities specifically aren't fully aware and get left out. I mean, I don't have any children, but I am a daughter, and I was taken care of in two different manners, right? I come from a lower income family, and so I remember that the person that would take us to the bus stop and pick us up sometimes was a block away from us, so that in-home childcare is what people in my community mainly use. And another thing that needs to be pointed out is sometimes, especially in these minority households, is that the older children end up taking care of their younger siblings. My brother added pegs to the back of his bike to pick me up from the bus stop, and he was 7 years older than me. So a lot of the burden always falls on the older children. And the more that we could do outreach to communities, whatever that looks like, and I would suggest, if this gets approved, partnering with several organizations to try and make sure that everyone knows that this is available. But those are the things that I think we need to keep in mind. But my question is, who are the 12 providers?
The outreach aspect of that, because and as we get further into the proposal, we actually, outreach is a central part of our work with early embrace, exactly because of what you said. Sometimes outreach feels like a nice add-on, but when you're talking about equity and making sure that folks have access to resources, that outreach strategy has to be intentional and has to be well invested in. And so our program design, the beauty of home-based childcare is that, right, it soars when you think about culturally responsive and culturally sustaining practices. And so we've already started to develop partnerships with organizations like Workers Dignity, for example, to talk about the language barrier, right? How do we make sure that everyone has access, and not just everyone, but we're really targeting this to communities who especially need that those resources. So I would love your feedback and your ideas, but thank you for speaking to that need for strategic outreach in the 12 centers.
Yeah, the 12 centers, we said up to 12 centers, thinking specifically about the United Way's footprint in terms of the centers that we currently partner with. So we currently support 10 centers across the city, and I can provide a list of those centers at the close of this meeting. But also looking to expand our, there's a level of resource and partnership and community really for center-based care providers that comes with, being attached to that community. And so wanting to extend or expand that network of center-based care providers. So by expanding to, in the short term, because ultimately the long-term plan is for a strong, comprehensive strategy to be put in place for center-based care. But of course, in the short term, an investment that we will be talking about now would not suffice. It would not be enough to wrap around all centers in the community. So we have to start small in the short term, and then as we build that plan and come back to the city, then the longer term plan will be more inclusive of all center-based care. I hope that answers your question. Okay.
Councilwoman Johnston.
Hi, thank you all. Maybe I missed it, or maybe we just haven't gotten there yet. What is the dollar amount ask that you're asking for? Fun one. That's a terrible smile you've got on your face right now.
Was it that obvious? No, I'm kidding. So this is a complicated question, which we are figuring out. Okay, but I'll give you an example of how nuanced this process is, which is why we didn't come with one shiny number today. Okay, so walk with me, bear with me, right? So if we zoom in and think about one center, right? So one of the centers in our network, currently they serve about 145 children. I asked them, how many children are you serving that are on vouchers? Right. So it's a community-based program, and they serve children on vouchers, but also families that they have on a sliding scale. Okay, but we're going to focus only on voucher families. So when you look at the reimbursement rate for a family, which it varies, which is why it makes this so nuanced of a process. But the reimbursement rate, you have that column, then you have another column that has the parent rate. So what does the parent pay? What can the parent afford to pay? Right, the copay. And that varies as well, which is why it complicates the formula, because it is very specific, family specific. And then you tack on the additional reimbursement, the bonus, and this is a new wonderful increase or effort to increase the reimbursement rate that DHS implemented 2 years ago. So for, depending on whether a center is a 1, 2, 3 star center, you get an additional bonus, right? So all of our centers are 3-star centers, so they get the maximum bonus, right? So you have, just go back through, you have the standard reimbursement rate, then you have what a parent can afford to pay, then you have the bonus because it's a 3-star center, so they get more because they're 3-star and they're serving children on vouchers. And then you have the actual cost of care. When you subtract that out in this particular center, you add up that column, the loss, the hit that a center, that particular center took was over $90,000.
For the year.
For the year. So this is a hit for about 35 children. So it's a $90,000.
For how many children again?
Around 35.
35.
Yeah. About 35 children. It's an annual loss of $90,000 for this center, serving 145 children.
Okay, that's helpful.
Yeah.
So we're also tackling home-based stuff, right? So this is like, and so home-based is different, I'm assuming. They don't deal with vouchers, I'm assuming? No? Do they? Yes?
They can.
They can, okay. And this is, I don't have kids, so y'all are gonna, I'm a total idiot. I don't, like, all I know is my sister-in-law complains about it.
For the home-based work, so with Refugee Institute, we do have a number because we're working with a national organization, actually on an economic stabilization pilot, which I'm so excited about.
Okay.
And so that's $1.3 million for a 2-year pilot. And what that pilot will do is it will start with up to 30 home-based providers and actually provide them a guaranteed basic income. So right now, if you're a home-based childcare provider, the average national rate is only $8,000 per year. So these are folks who are depending on benefits, essentially to be able to even provide this service to their neighbors. And so through this pilot, our national partner will be providing a monthly stipend to families or to providers in our pilot. But then we also want the city to be able to contribute $6,000 annually per provider, right? So that's $500 each month from the city, and there will be additional funding coming from that national funding partner called Homegrown. And then also a part of that funding was technical assistance support. So business coaching, education coaching, so they have high quality early learning, and also support navigating the authorization and the licensing process that so many people are disconnected from as well.
And I just want to add to that, from Refi Institute's perspective, the framework is ready. When I say the framework, the people are hired, the models are created.
You just need the money. Okay. So
you.
here's my concern. Yeah. So here's my concern about ARP funds being used for something that is a constant need, is that ARP funds are limited and they're gonna go away. Who knows if we're gonna have another American Rescue Plan or whatever they'll name it next year. If not, probably not. I would, please let this go away. Like, the money's good, but the problem is bad. So my thought process is, if we can build into your plan some type of a way of measuring success so that you can use this data as a pilot to go back to the state that has much, you know, I mean, this is across the board. This isn't just Davidson County. Yeah. So, and it's probably the more, you know, bigger cities that are dealing with it more than DeKalb County, for example, right? And so to go back to the state and use this to receive more sustainable funding, because if your problem is you've got the reimburse rate that is far below what the actual cost is, let's get that up there, but they're going to want the data to do it. So that would be my ask here, which I think is really important. I mean, I want to be able to support it because I think they just came out with a budget giving a ton of money to higher education, which is great. But how do we get to higher education? Everybody has to start somewhere. So to me, that's way more important. So let's use this. Yes. You know, I want to make sure we're using these dollars to really make an impact, and I don't want it to just go away in 1 year or 2 years. Let's let this be the groundwork for a completely different model of funding every single year from the state, every county that needs it, however they want to handle it. But that's what I really want to see is measurable success, short-term, long-term, each child, whatever it is, so that we can say, hey, this is what we've done. So when we've funded, temporarily, we've funded childcare, but long-term, we've laid the groundwork for a completely different system of funding this need.
And frame of mind that we designed this around to be a pilot that then could be curated to across the state and across the nation, really, and you would provide the seed for that pilot. Absolutely. Thank you.
I've got a couple next. If I could, I just wanted, Dr. Krum, could you, you were going to try to share there, when you mentioned the state, there are different programs right now through the state with some of the child care. Can you explain just a little bit, is that for the parents, for the provider? Is it by centers? So, I think, hold on, there we go.
Okay, thank you. The state, like many of us, has money that they've set aside that's also same types of money. One is the child care enhancement grants that the state is doing. So I'm assuming that that's a part of what you all are looking at as well. The child care enhancement grants gives grants to centers to address certain things right now that impact their supplies. It's a number of things that centers can apply for that allows them to actually get funding. And so the other thing that they're able to do is, for example, with us, if you have somebody who makes less than $20 an hour who's in child care, and that's child care period if it's licensed, then you can apply for enhancement to their wages. And the enhancement to their wages through the state is based on that person's educational level or how many hours of credit they have in the early childhood field. I can't apply for it directly as the director of the program, but the individual can make application and the money goes directly to the individual instead of to the center. So as you all were kind of talking about some of the things that you are hoping to do in terms of providing enhancement. These are some of the things that just came to my mind that I'm thinking is probably, or I would assume is in your formula for at least opportunities to also apply for some of those enhancement grants that's available to centers through the Department of Human Services. So I don't know, but I wanted to make sure I mentioned that as well, that as we're thinking about it, we're also thinking about those pieces also.
I hate it when you turn me off, Mary Jo. So when you're talking about business support and things like that, is that something, because I think that's a lot of small businesses that do not know where to go. They don't know what resources are out there. And then even when they find out, okay, here's a resource, their mind is blown with, well, how do I mean, you know, writing a grant is really, it's an art.
Yeah.
And so can we add that into with these centers to help them take advantage of resources that are already there, not only pointing out where they are, but also how this is how you do this. And, you know, that to me would be helpful to add into this pilot.
That is really well said, and that's actually for our design. For our model is not something we created. It came from Connecticut 20 years ago. It's called All Our Kin. They created a support network for home-based child care providers. They did that because over 90% of home-based child care is unlicensed. So you only get access to those state funding and those resources if you're licensed. So overwhelmingly, home-based child care providers do not have access to that. In Davidson County, we only have 17 licensed home-based child care providers, and we know that there are hundreds that are operating. And so that you don't get the establishment grant, you don't get the expansion grant. Child care centers receive funding through CARES Act and also from the state's American Rescue Plan dollars. If you are not licensed, you don't get that funding. If you're authorized, which is a different category, separate than licensed. So let's say the state recognizes that you're doing this. It's not illegal. They know that you're doing this. They provide you a child care certificate, but you're not licensed because maybe you care for 4 children and not 7. You still don't get access to that funding. Who does that impact? It's impacting, you know, disproportionately the already vulnerable communities, and that's why we actually created a program inspired by this organization in Connecticut 20 years ago to say, we need to have a pathway to licensing, right? Because when you go to that DA's orientation, it's intimidating, you know, and they're not there to hold your hand. So the business coaching is a critical part of making sure that this is actually a sustainable effort.
So I've got Councilman Gamble, and I saw Jose, and I do, you know, intentionally, we knew this was going to be a deep conversation, and we also wanted to cover other things today. So at some point, we'll have to find kind of the way to just press pause and come back to this. But I also thought it would be helpful to have a 2-part conversation so that you all can hear some of the questions and that we can really maybe come together with a proposal that kind of addresses some of the questions you might have. So let's get to a few questions. Councilmember Gamble.
Thank you, and I'll be brief. First of all, thank you all for all the great work that you all are doing in this space. Thank you for being here today and really laying out for us a comprehensive idea of what the challenges are, what the barriers are, and ideas for addressing them. Mm-hmm. So, in looking at your proposed child care investment, there were 3 things, and I just want to highlight those and suggest that when we have you all back, you have your proposal includes funding for each one of these, the stabilization grants for 12, at least up to 12 center-based providers, a planning grant to resource facilitate data mining and advocacy expertise, the business consulting or trying to, the pathway to helping unlicensed operators get to licenses, and then, actually that falls in the next one, the stabilization and startup grants, the home-based providers, and helping them move from unlicensing to licensing, so that when you all come back, we'll have a good proposal or good idea of how much funding it would be, the time frame of the work that would be involved with each one of these 3-pronged ideas, and an idea about the outcomes, how many families would be impacted, how this would increase the number of operators in these child care deserts that we have in our city. And again, I just appreciate you all being here today.
I have a question in response to that, and it's not explicit here, but I'm hearing a couple of spaces the value of measuring this very concretely. Would you be open to that dollar amount, including giving us the capacity to really measure this in a way that we then could say to a larger audience, this is a way forward?
Definitely.
Thank you.
And I really like the idea about creating a plan, and which falls into the second planning grant, so that when it's all said and done, we've not only invested in addressing these issues, but also invested in having a plan, path moving forward.
And just to underscore that, so this creation of the plan, right, that process is underway now through summer, right? And so the thinking is that this process, funding or not, will happen, right, to develop a plan. But the infrastructure, right, to Travis's point, to really understand the data capacity needs that we have, right? Because we really want to understand at the very basic level what the data says and leverage the data as a flashlight and not a hammer for folks that will be partnering with us along the journey to come back with the plan and with an ask, right, that says this is the plan that cross-sector groups spoke into, from health to community-based organizations, nonprofits that focus specifically on the people of color, you name it, they are being asked to sit at these tables that are really digging into components of health, high-quality learning environments, and supported and supportive families. And really, in those spaces, digging deep and understanding what are all the factors so that, to your very well-spoken point, we are not throwing money in a short-term fashion and then we look up 2 years later, we're out of money, and the problem is still there. So I just wanted to underscore that there is a process and intention to come back for a longer term. The plan is for the longer term strategy, and these pilot short term asks are to kind of tackle the low hanging fruit to see if we test this. It's testing a theory. If we test this theory, then perhaps it could be a part of the long term play.
Jose, did you want? And then I've got Sarah.
Man, so many thoughts. Let me see if I can get them out in some sort of coherent way, and maybe there's a question in there somewhere. Because some of the things that are in my head is what's been alluded to already. First, let me say that I'm really energized by kind of the entrepreneurial thinking that I heard in the presentation today, because like this is the type of thing that I'm thinking, all right, we can look back to the point you're making 3 and 5 years from now and have invested what is going to be a big ask. I'd see it coming, right? We as the charge of this committee is to invest in really bringing about meaningful change, and like this is one of the most innovative and entrepreneurial presentation that I've heard since I've been in this committee. So appreciate that. Appreciate the passion, and so linked to that, the notion of, and this is where Travis, I think, connecting the dots. Like your first part of the presentation, talking about the work that has been accomplished and has been done with Judge Callaway and that type of thing, and then, but it's like, so how does this prevent that? Like that's an aspirational pitch that you made, but it's like to the extent that, whether it's Connecticut or whether it's whatever, that we can be persuaded or have the data or the information say, if we do this, then this happens. I think that's not only good for us because it'll be easier, but it'll convey a message to the community at large that this is money worth investing because it's going to be a good amount of money. I want to reiterate, if you want to jump in or you want to let me finish, whatever. Okay. I really want to reiterate the point that was made around foreign-born populations and immigrant and refugee families, because that really is a low-hanging fruit. Somebody mentioned that, because indeed that's a construct that these families have, and connecting it to the economic vitality, giving you the business savviness to like really adopt this as this isn't something that you do just for your grandchildren or for your neighbor, but this is something that you do to affect your economic stance. Like that, I think that's a really important opportunity of this. And then the last kind of question that I have is, so I understand the big stakeholders in this is United Way, you guys, RAPA, is that the right pronunciation? Who else would be at this table, or would you want to be at this table that is not? Maybe I'll stop there.
I can answer the who else is not at this table. That I can answer that quickly. I was surprised you didn't need anything else, because I always tell people Head Start. I'm like, we need to pour more and more and more into Head Start. But I guess you have everything.
Well,
but
I think the point for me is what you're proposing is the gap, right? And so the gap that we know that families have is that they need services at times when Head Start is not operational.
Yeah.
And so it doesn't make sense to say, well, let's give. When we know that parents are struggling because they are working hours that we are not in business, and so we need to fill this gap.
Thank you.
And I want to buttress that. So I think your question highlights another gap. There just aren't enough of what this is trying to be. There just isn't enough. There aren't enough bridge builders, right? And so I think that again highlights the imperative of demonstrating here is what a solution can look like, albeit a small scale. We do need more. We need more nonprofits that are looking to be a resource bridge for home-based providers, right? We need a Rafa Institute that is truly like focusing. Listen, you see, look at my face, so you know what community I'm in. But I have interest in justice everywhere, right? I would love for. I mean, we have the largest Kumanji Kurd population in the world, right? We need somebody who's focusing in that space, because I'm sure the same issues are there, right? We work with the families that are, from Guatemala, where Spanish is their second language, their indigenous tongue is their first language. They have their own set of challenges, right? Who is talking? So we need more entities that are helping to bridge these gaps, that have the expertise that we don't have just because of the cultural divide, right? So it is a challenge, but again, I think that points out the reality that if we can demonstrate a kind of solution, a framework, then we can call more to say, hey, here's a way forward. Let's form a nonprofit from this community that can really focus and has the cultural competence to engage that community in that space. So I think it's an important question. Man, I wish we knew all the answers to it, and I just think that we need more answers.
I'm going to try to get to two more. I know Sarah and Junad had questions. Let me get the questions, because that'll give you information for next time.
Yeah, first of all, just to echo everyone's comments, thank you for being here and for your compelling presentation. I had just a couple of questions. When I look at the proposed investments, the focus is on stabilizing kind of what exists now, it seems like. And then I look at the landscape, and obviously what exists now is still not even close to what we need. And so what I'm trying to, the gap I'm trying to bridge is, in your plan, which is to stabilize what we kind of currently have, and I do think there's some, you mentioned some startup grants for the home-based providers, but at least with the center-based, it's stabilizing what we have. Just a little bit more information for us as we continue this dialogue on, obviously they're operating, at a deficit in terms of their reimbursement. But is the goal to stabilize them so that they can continue to increase the number of children they're serving? Is it to try to make sure they just stay at this current level? Is the goal to have more of these centers? But just how are we going to use the investment to build to the ultimate outcome? Because I think that's kind of part of what Courtney was saying is we would love to have this investment take us on a path to helping not just to sustain, but to also grow. And so just sort of that mindset as you share more information with us. And then the other thing that would be helpful, if you do have any of it, is you mentioned something about investments other cities are making. But if there are any particular models or programs or investments that have been made, particularly in connection with COVID, that you would like for us to see, that would be very, very instructive to us. But thank you again.
And I'm going to ask you guys to hold the answer for the next time. I just want you to know what to come with next time prepared. Junad, let me get your microphone.
Thank you. Thank you all for coming and for the great presentation. It was very eye-opening. My questions are similar to Sarah's, which are the presentation and kind of the proposal, it seems like, is very provider side heavy in terms of the low-hanging fruit of and maybe this is just due to the pilot project nature of it, but the PowerPoint identifies issues related to accessibility in terms of the number of spots available and the ones that are currently, it just reflects that there's a more need for accessibility and also affordability. And I don't know if that's something that can be addressed in this type of proposal, but I would encourage y'all to see if there's, if there's something creative we can do to address the accessibility and affordability issues also, since we've kind of got a one-time shot at trying to be creative in this area.
Great. Again, thank you all. I hope that's good feedback. Did I miss anybody else that wanted to add any directive for next time? Okay. So thank you for the patience of doing this in 2 sections. I just felt like it was a pretty deep kind of conversation that I didn't think we'd gloss over in one meeting. So thank you all for being here. If you need parking passes, they're right there for the parking garage, if you're in the parking garage.
Thank you.
And so again, and thank you then to our other guests for your patience as we get to the good stuff, as we get into the details on this. Thank you, Dr. Kroom. Thank you. I'm going to call our Director of Economic and Community Development, Courtney Pogue, up. Director Pogue, thank you. You can take one of the seats down here, or you can come up here if you want. Good to meet you. Thanks for being here. We'll be in touch. Awesome.
Yes, ma'am.
So as our committee knows, and just as an update, our council did approve our $20 million recommendation for a small business recovery plan. And 18 million of that is directly into funds that will be managed by Pathway Lending, both half in grants and then half in capital investments, loans, longer term relationship.
You said all the 18 million would be managed by a Pathway. Are we not doing the 5 million for a financial institution in North Nashville that would be administering that?
I think they're still looking at that partnership. I don't have any updates.
Okay.
Director
Because that
Pogue
was a part of the recommendation.
Okay. Director Pogue may have an update on that.
that.
But the other key part of that was we did, the council did approve $2 million to have nonprofits provide technical assistance as well as marketing and outreach, really towards the goals of the plan. So this is kind of that part 2 of, do we have some nonprofits? I got some suggestions from some of you on the committee. We worked with some of these partners with our CARES Act, and so we've invited them to come to this session. And again, it might end up being a 2-part session. We wanted them to be able to hear about the plan, Director Pogue's vision, How can we make sure that we actually hit the targets that we intend? And so for that reason, then we want them to be able to hear that and probably come back at our next meeting with the actual proposals. So I'm going to turn it over to Director Pogue.
Well, good afternoon. I'm Courtney Pogue. I'm the Director of Economic Community Development for Nashville. As you heard from, is my mic on?
Sorry.
Oh, yeah. I feel like I was talking to
I
myself.
could hear you really well.
Shall I start over again? Good afternoon. My name is Courtney Pogue. I'm the Director of Community and Economic Development for Metropolitan Nashville. I would like to thank all of you for being here again to support our plan for the Nashville Small Business Recovery Fund. It's a $20 million fund that was approved by Council just last week. As Mary Jo just kind of laid out, a portion of that $20 million will be geared toward nonprofits or business support organizations to provide marketing and outreach, but also technical assistance, which is sorely needed for our small businesses. This program or initiative cannot be successful unless we have your support in providing the outreach and the efforts to make sure that all those citizens and small businesses that make up parts of Nashville and make Nashville what the city it is are involved in this process. We know that roughly half our business population here and half our labor force is comprised of small businesses. We know that $33 billion annually come from our small businesses. So we know the pandemic has been adverse and impacted your businesses. And we would like to really work with our nonprofit institutions and really understand what you can do to support this effort and provide services in the capacity of marketing and outreach, but also providing technical assistance to help those businesses navigate this process for applying through this program, but also on the back end, help stabilize those businesses going forward and working with Pathway Lending in doing that. Ma'am, you like to add anything?
Well, one of the things I wanted to do is actually have you all introduce yourselves, come up. I recognize a few faces, there's a few new faces, but I did want you all to just share kind of how you work in this space already, how you and your organization can enhance the small business recovery plan by reaching out to those small businesses. I'm not asking you to know exactly your proposed plan today, but you may be more in the area of technical assistance, and you can talk about some of the assistance you provided in CARES Act. You may be more about some of the outreach and marketing, and that you have relationships with these businesses and make those connections to Pathway Lending. One of the things that we noticed with the CARES Act, we did have a very distinct goal of achieving at least a 30% funding to minority businesses. And we hit that goal, but when we looked at another layer of the numbers, we realized we didn't actually have as many businesses in North Nashville, Bordeaux, and even Southeast that were the areas that were hardest hit by the pandemic. So even though we hit a target that we thought was important, I think we really want to make sure that we actually connect those businesses to these funds. And how do we get that connection and partnership with Pathway? And we think that you guys are some of the solutions. So we want to hear from you. I don't know if y'all want to come up. I mean, we can use the podium. Does the committee have a preference? If it's easier to use the podium, and if I can, I'm not going to set the timer on y'all, but, give us a few minutes of kind of your organization, the space you work in, kind of what your first thoughts were about how you might connect with this plan. And let me turn that on for you. Hold on. Oop, nope, that's not it. Hold on. Vice Mayor Schulman was here before, and he could have told me where's the public mic?
On the public table?
No, that's that table. Well, let me see. Maybe that is. Try that. Yep.
Perfect.
Thank you.
Teamwork.
Good afternoon, and thank you for the invite. I'm Angela Crane-Jones. I'm the CEO of the Nashville Business Incubation Center. We had the privilege to work with the committee previously, and I'm very thankful for it. And so for anybody that may be new in the room, we've been around for 35 years and been providing business development resources to entrepreneurs, and our focus is on women and minorities. And so I'm just going to kind of recap what we were able to do with the CARES Act dollars that we received previously, which we received $600,000 to do management and technical assistance. We also assisted with outreach. We were able to work with 153 unique individuals to help them receive funding and also come up with a strategic, plan, because that was one of the biggest issues, like, well, how do they move forward? And it was helping them create a, a strategy. And from a metrics standpoint, we conducted 31 workshops. We also did 179 one-to-ones with individuals, and then we worked with 3 other partners in the community as well, trying to help get outreach out. And from a demographic standpoint, 72% of the individuals that we worked with were female, 25% was male. Our applicants were 79.8% African American, 2.4% was identified as American Indian or Native American, 1.3% was Asian, and 17.2% was white, and 4 presented themselves as other. And from an outreach, standpoint, where we receive referrals, were Corner sent us 10% of the clients that came to us. We got 4% referral from EC, 10% came from Pathway, and then we have this huge gap where it says other, which we attribute that to the social. We did a lot of social media, and then 16% of those clients came from NBIC. One of the things I would like to, and then I'm gonna turn it over to to Eric, but I wanted to speak to that we have continued to track many of those individuals and have continued to service some, mainly because they may have continued to run into a barrier, and mainly those were obviously, like restaurants, because they were, struggling with getting still individuals in the, the door, or not being able to really market, properly. Although we helped them get a website, it's still a huge digital, gap that was left with when they need to continue training. The areas of support that I feel is still needed is around strategic, planning. Like, how do they continue? Because obviously we thought in December 2020, by the time we got to, last summer, we would have been out of that. And so and we only worked with them on, like, what do you do for the next 12 months? So it's continue having strategic planning. And I'm gonna speak to as far as the relationship with Pathway. And I don't know if Pathway saw the same thing that I saw, but one of the biggest issues that's a barrier and it's a gap in the community is, yes, you may put, $18 million on the street, but why some people didn't get funding in the North Nashville or the Southeast is not only from when you think about the accounting, perspective, getting the books in place, but some of the requirements, individuals didn't have business license. And there's, we're gonna say miscommunication, because a lot of people, they may go to get a business license and then they get the information or read and say, if you don't have $3,000 in revenue, you don't have to have a business license. And so then obviously, it's 2 years later and now you're doing $20,000 or $200,000 and you don't have a business license. Or one of the issues we ran into that we helped a lot with is that they may have one on their own and set themselves up as an LLC or, a corporation, but then because they didn't have any consultation, they didn't realize that has to be renewed each year. But even bigger barrier, even if they're renewing it every year, if they set it up themselves, they don't have the articles of incorporation. They don't, have an operating agreement. So at the end of the day, when they try to upload everything in the portal, they still don't have the documentation they need. So that was one of the, the lessons learned, because again, everyone assumes that if someone's an LLC, that they're doing the proper documentation. I'm gonna turn it over to Eric, because Eric worked with a lot of the individuals from an accounting perspective.
Good afternoon. Just like, I'm going to piggyback off of what Angela was just stating, but I've been in the consulting field for over 20 years now, and what we see is a lot of small businesses don't have the foundation they need to be successful in the long haul. And so what we try to come in and teach them are, we do an assessment of them first, figure out what they're lacking in and so forth. And because what we're trying to identify is what do they need to be successful long term. And a lot of things that we see, main reason why a lot of people weren't able to take advantage of the PPP loan, the EIDL loan, and all of those different things because they didn't have that core structure that they needed, that foundational structure that they needed for their operational standpoint. And that goes from accounting, being able to estimate and bid on contracts, goes into being able to have the IT structure that they need. All of those things we look at and try to figure out how do we better assist these companies and firms to be successful. And a lot of other things that we look at, a lot of these companies are minority companies and different things of that nature. We try to identify, hey, why don't you take advantage of all of these different certification and designations that you can get through DBE, 8A programs, service disabled vet, women-owned business, so forth. Just like the other, you can get that low-hanging fruit of getting sole source contracts and different things of that nature. So we show them how to get all of those different certification because it helps them diversify revenue in the long haul. A lot of our clients that we work with that were federal contractors during the pandemic, they didn't skip a beat because the federal government kept spending money. And the firms were already within that space, they kept moving along. But the firms that didn't have their structure already set up, where they were only focusing on one commercial or residential income and so forth, that's when they fell through the gap. So what we teach them is, hey, we got to diversify revenue and get all our core foundation set up so that we can move forward in the future. Because no matter if you have one employee or 5,000 employees, we set up the accounting system the exact same way so that you can grow into it. Same thing with IT and so forth, so that you can grow into it. And it's a lot cheaper to do it when you have one employee rather than 500. So we say, let's invest now, let's do it right now so that you can be a better and a more viable business in the long haul. And that's our passion, because we like to see companies grow. We like to say that we had a part of that at the end of the day. And when we see that and we see that them grow, we say that we did our job, and they can always come back to us for assistance, and that's what we're here for.
Thank you. Appreciate y'all being here today.
Good afternoon. Today, I stand here as the president of the Bordeaux Business Coalition. Most people in the city know me. My name is Sam Kirk, as executive director of Youth About Business. So we started Youth About Business years ago to begin training young people about the world of business. But the Bordeaux Business Coalition, 8 years ago, was founded because as we knew development was coming that way from the city, we wanted to make sure and strengthen those businesses that were in that area. So we began to put things in place like the technical support for legal, the technical support for marketing. So I don't want to be redundant because I think my two colleagues have already expressed small businesses need that type of training. So one of the things we did receive PPP funds. I do think it's unfortunate that so many of the small businesses don't have their accounting systems in place. So the only thing I would like to say, and thank you, Courtney, for inviting me today. I didn't come to speak, I came to listen. But the one thing I would like to say is giving the ability to the community to access and manage some of the capital is very important because they're more sensitive to the needs. And so Pathway Lending, great that they've got $18 million. We are building a Bordeaux Economic Development Center so that we can make sure that those businesses come to a place where they feel comfortable, where they can get the access and they can get the proper training. So, I mean, we live in a society today, if your marketing plan doesn't include social media, you're going to get left behind. There are so many things that small business owners, as they're building, and if they don't have access to capital, they don't know where to go. And we really want to see, I focus today again on the Bordeaux area because I'd love to see that area revitalized because there are so many opportunities for the small businesses that are there, and we want to focus on that area. So thanks for having us in today, and I look forward to listening to some of the solutions that this funding will provide.
Thank you, Mr. Kirk.
Hello, how you doing today? My name is Nathaniel Carter. I'm the Director of Workforce and Employment for Stand Up Nashville. I came to listen today, and I didn't come to ask for any funds or anything of that nature, but just to give you all a little feedback on what I do. I am one of the coordinators of a great program called the MC3 program. It's a union-based pre-apprenticeship program, and we govern around the city of Nashville. We're in tune with the 15 union skilled trades in the Middle Tennessee area. Myself by trade, I am a union electrician, journeyman level wireman, and we were granted the first CBA agreement in the city of Nashville. So I am the major part of hiring for the Nashville Soccer Stadium, the 318 jobs that they are rolling out. I haven't been in this setting. I haven't seen any of you all since I've took this position. So I wanted to come down here and put a face on you all and see what my beautiful people of the city of Nashville are actually doing. So I'm not asking for no money. I just wanted to come and see my people of the city of Nashville and just tell them that I am actually out here working, doing my due diligence, and trying to put people in better career-paying jobs in the city of Nashville. And I appreciate what you all are doing, and you all keep doing the great jobs that you all are doing. Thank you. Thank you for your time.
Thank you for being here. I'll just make one comment. Just as Councilwoman Gamble said, we are asking Pathway to partner with potentially 2 other organizations, CDFIs identified in North Nashville. We really had quite a bit of discussion about the importance of making those connections. And it may not be, I'll say, ideal that one organization is named in the resolution, but that is exactly why we want and set aside additional funds for nonprofits to make those connections, because we are aware that it is not a perfect situation, but we do want every business, and there's money set aside specifically for North Nashville and Bordeaux to access those funds. So we are counting on the nonprofits to be that connector, to be that bridge. We do want some of those funds with the other CDFIs. We have asked in the past, and they just didn't have the capacity. So we hope that it's a different story this time. That is the plan. But we know that if we don't have them as the CDFI, even more importantly, that we have you as the nonprofits to be that connector, to make that connection, to make sure that these businesses do go to Pathway, and that maybe as the almost the intermediary, that they can work with you to get their plans together, to get financial statements, to make sure that they are prepared, and kind of that in between with Pathway. So I know that's not necessarily ideal, but that was really important to this committee. I'm speaking for y'all, but that was part of it. Councilman Sepulveda, let me get your mic.
All right, thank you. And thank you all for being here, and shout out to the MC3 program. I know that Vonda has worked on that a lot too. I was able to go to all the graduations y'all have had so far. It provides great hands-on experience. I had a question, and I apologize. My work schedule didn't allow me to be here for the last meeting, or maybe I had COVID at that point. Don't remember now. But just for my clarification, the organizations that are here today is to do specifically outreach for North Nashville. Is that correct?
For everyone. So
Okay.
Actually, that's one of the things. If I can do this, if I can pull it up fast enough, I wanted to read to you the 9 organizations that were
That's
mentioned.
what I wanted. Yeah.
Because we don't think that that's necessarily everyone. There might be more. So let me, bear with me for a second.
Look at the email.
Yeah. Let's see. Okay. The nonprofits that were identified were the Bordeaux Business Coalition, the North Nashville Business Coalition, JUMP, Bordeaux North Nashville Chamber of Commerce, the Equity Alliance, Stand Up Nashville, Nashville Business Incubation Center, Conexión Americas, Southeast Center for Cooperative Development. I think that was it. Did I name 9? 1, 2, 3, 4. Yes. So those were the 9 that were already specifically reached out to. If there is anybody, and I actually even invite our nonprofit partners, you may have somebody else that you know is doing great work in this space. Sometimes nonprofits work really well in partnerships. Sometimes they want to grab their own space. But you all may have recommendations that this committee needs to consider, and then the committee may have some additional names. Once you're kind of thinking about it, then you see somebody out in the community and you're like, oh yeah, I forgot to include them.
Yeah, just wanted to make sure that there were Hispanic and immigrant organizations that had been reached out to. Thank you.
Councilwoman Gamble?
Thank you, and thank you, you all, for being here today and talking about your organizations and the work that you do and how your work could possibly complement and help with our work to reach minority and small businesses and providing support for them. I do want to mention that you sent out the invitation to all of those organizations, the 9 that you just mentioned. The invitation went out kind of at the end of last week, and so some of them may not have been able to appear here today.
Yep.
Just if you could talk about what kind of follow-up we're doing. Today's meeting request was just to invite them to come, talk about their organizations and the work that they do and how they may partner with Metro to address what we're trying to do with the Nashville Small Business Recovery Fund. Is there, if you can speak to Mary Jo, what the plan is as far as inviting people back and allowing time for them to actually submit a proposal, and what the time frame would be on that?
Yeah, so, and I'll go first, but I'll let Director Pogue, he really was going to do the outreach. Exactly what you said. We did not want to make this meeting bring us your proposal. We just thought it was way too premature. It wasn't enough time. It wasn't fair to ask them. And many of them haven't worked with us yet. And so this was an opportunity to establish that relationship. And we kind of wanted, again, it was kind of that, let's meet, let's have some questions back and forth, and let's put a little bit of framework around what we think those proposals could look like. So I'll turn it over to Director Pogue, and then I'm going to get the committee to be thinking just over the next, 45 minutes. We have our next meeting on March 9th. If we think we want to do something in 2 weeks, is that enough time to ask nonprofits to submit a proposal? Do we want to just wait till March 9th? I don't want to try to rush the process and make it sloppy, but if the committee's willing to meet and we can keep it organized, we could have what I'll call an interim meeting as long as we give it enough public notice. So not looking for answers on that yet, but that's kind of when you ask my thought on time frame. This is important because there's deadlines in the plan with information sessions on starting March 1st. We've got to get a recommendation to council, and that meeting is March 1st. So that's why I was thinking we might need to get ahead of that, because if we've got to get information sessions in the month of March, the businesses get to start applying April 1st. So that's why I just wanted to, there is a sense of urgency to this, so.
Yeah, so the overall goal was to hear from nonprofits today, and then from there, craft out a sketch of what we're looking for in the sense of either marketing, outreach, or they can provide technical assistance, providing their qualifications to make sure we get people who can actually do the work. And then from there, we'll select those respondents that are most qualified, and then we'll bring them back to this body. They're not looking for in-depth procurement process. Is that required? I'm not sure.
It's not.
Okay.
It has to still go back. The recommendations that this council makes will still have to go back to council. Even though council approved the $2 million, because we didn't have the nonprofits identified, we still have to take that back to council for approval for a nonprofit grant contract.
So from there, they can submit proposals, and we'll exhaust that $2 million based upon those that submit. Of course, if you just do marketing outreach, and that's your kind of focus, I wouldn't expect it to be $2 million, and I don't think that's not $2 million. But if you're looking to provide marketing, outreach, and technical assistance, and then of course that requires more capital. And we'll make sure that within that scope of work that it focuses on the needs that we have in the city. I think what we saw with the CARES program is that, yes, there was a goal that was met of 30% to minority businesses, but you drove down to the actual zip code data, it was not well dispersed. So in this case, we asked both Pathway, but also our nonprofit partners to help make sure that we're reaching those communities that have, one, we know from a PPP standpoint, a lot of that money didn't go outside the core of the city for PPP also. And then look at the CARES program, it's kind of the same format. So we kind of have a shift here to make sure we're actually hitting those communities and really making sure these people, our businesses, are being supported going forward. And so as we look at these two things that were approved by this body and council, this is just a first phase. Yes, we need a strategy. I think I mentioned that several times in regards to economic development. I think I've spoken about it the past couple of days. And so that strategy was be a small business strategy in which we look at all our ecosystem and how it's structured. I think you heard from NBIC, and they've stated we have a fragmented ecosystem as relates to small business. So this is one of many phases we need to kind of really address going forward within the structure of Metropolitan Nashville. And so as we roll this program out, as we look at our strategy for small businesses, and look at our strategy for the city as a whole, we know there will be other opportunities to engage our nonprofit partners because they are the core of the success of, one, this initiative, but also our plan, but also our small business strategy going forward.
Thank you. And so to kind of wrap that up into back to the time frame, if we allow 2 weeks, because what you just described, Courtney, is that the organizations would submit proposals to you, to your office. You would go through the process of evaluating those proposals, and those that you feel meet the criteria would then come to the committee to present, and then we would make our recommendation on those organizations. Did I hear that correctly?
Yes.
Okay.
So 2 weeks. I think 2 weeks would be sufficient. I'll put something out by Friday on what we're looking for. Probably a one-pager of services they can to actually apply for this initiative. We'll give the organizations a week to respond to that. I'm not looking for a 20-page response. I think they all know what they can do, and they have the backgrounds. And then from there, we make the evaluation and bring it back to this body.
And there will be parameters, I guess, as well, as far as what the funding amounts, like a range of funding amounts for the organizations, or are they just sending requests based on the work that they're doing?
They can submit requests based on the work that they're doing. So
Okay.
I think there's parameters, and I've been doing this for 25 years. So if you submit me a proposal that for one task and it's 6 or 7 figures, then.
Well, that's why I bring that up, because we are hoping to work with as many organizations that are doing this work in these distressed communities as we can, and we have $2 million. So having a range that an organization could apply for based on their budget maybe would be something that would try to kind of limit the scope of what they're asking for and what we're able to provide in a recommendation. Might be helpful.
Yeah, I can spitball something, put a range around if it's marketing outreach, if it's technical assistance, or a combination thereof.
Based on their budget and the members or something of that nature.
Based on our budget, based upon industry standards for providing that type of work. Based on historical data, what we did with the CARES program also, so there we have that format to look at.
Yeah, I mean, I think it's helpful. You know, Director Pogue and I talked, you know, if we can get several organizations, more than a handful, we're probably, you know, you're like up to 50,000 probably for the outreach. That gets you part of or a staff person that can be focused on that. If it's technical assistance and we can get 3 or 4, we're probably talking 300,000-400,000, you know, kind of. So I hope that's helpful for folks to say.
Yes.
If we get 5 applications for 800,000, we can't fund them, and then it just takes so much longer to pare that back down to you based it on that, but now if you only get this, what does that look like? So
Right.
I think that's kind of, you know,
That's where I'm going. As someone who's written grants and many proposals, it's helpful
nice to know what ballpark
to know
we're
on the
playing
front
in.
end what the expectations are and what the parameters are.
yeah. Eric?
What is the time period for the period of performance for this program?
So you might have the applications, the period.
Applications will start at April 1st. We get everything in place with Pathway. Then from there, they'll do a round of 30 days to get applications in. That is not, you know, hard and firm. It can be extended based upon the volume of applications. If we get 2,000 applications in on April 30th, then yes, we will close it. We get 200 applications in, then of course we need to kind of extend that. So I would say
Outreach has a shorter time. Technical assistance has a longer time.
Gotcha. So how long will the technical assistance, is it a year, 2 years, or?
I'm thinking it's up to 6 months.
6 months.
Up to 6 months.
Got it.
And it's just more from a timeline perspective. If the portals open on April 1st, and we know one of the barriers for many small business, especially minority business, is they need assistance, one, with filing their taxes. But the tax deadline is April 18th, and unfortunately, most people are going to wait until the last minute. So I'm not for sure, Connexon can speak to this too, but that's going to be a huge barrier for qualifying from Pathway because, you know, I've worked with Pathway many times, so I know that's going to be a barrier. And then the second, we need to educate. You know what I'm saying? In the sense of, I know it's very, very important to get the money on the street, and all people want the money on the street, but we also want to make sure the people that really need the money are getting the assistance that they need in the sense of truly understanding, because it's one thing to say, Pathway to say, okay, we need your LLC because you said your LLC. The gap is they don't understand that they need an operating agreement. So are we spending any time, and I'm just making it up, it could be 2 weeks or 3 weeks, where we're, you know, partners, whoever's going to be helping do the outreach, that we're all singing the same song in multiple languages so everybody understands what is truly needed, and they're getting that assistance even with that partner, the outreach partner. I hope I make some sense.
No, I think you definitely made a lot of sense. I mean, education on both from this standpoint of this program is critical. From the standpoint of the grant program, however, there's a loan program. And that's why $9 million was set aside for that program to make sure it's more wraparound services to help with businesses that's really scaling up, but also provide the wraparound technical assistance that's sorely needed for understanding what an LLC is, understanding filing your taxes, and having all those other documents in place, and doing the education to make sure, one, that you understand what is needed for this program, but also understand what is needed to make your business successful. So it's a kind of a two-pronged approach. You have the one component being a grant program, and the other component being the actual loan program. And so that's why we look at a much more extended time frame for both. You have a very short time frame for the grant program, which is not heavy into our requirements typically we have for a loan program. Then the backing of the Nashville Opportunity Fund, which is managed by Pathway, which has a much longer lead time.
Yeah, I do appreciate your comment about kind of that April 18th and the tax day. And I will say one of the things I've heard Pathway share with this committee at the last meeting and in conversation with Director Pogue, when they'll accept an application and as they review it, if it's not complete, they just kind of call it a placeholder. They don't kick you back out. So even if somebody applied after April 18th and it, you know, or let's just say, I'm making up dates, but it was April 25th that they applied and they didn't have all their documentation quite perfect, they'd still hold their spot another couple weeks and give them that time to get documentation in. So I've heard Pathway say that many times. They don't kick people back out. They kind of hold it as a placeholder.
Can I just say one more thing? And
Absolutely.
I won't say anything else. I apologize. You're absolutely right. They do allow to keep them in line. But when the funds are exhausted, then you just have a, you know what I'm saying, a wait list to say if additional dollars come out. And again, that's the gap I saw. Those are the emails I received. because we're trying to work with them. Because some things, although we're educating them, it still takes, time. To get those two or three items into place. And now the funds have run out in 30 days because we weren't intentional on the front end to just making sure we're educating and making sure it's equal footing. And I think that's what my biggest concern is making sure it's equal footing and not the same individuals that's already received grants, because now they got their ducks in a row.
Got it.
So I think as this program, we're asking for real-time reporting back to me and also this body to make sure if there's applications in the queue, if there are approved applications, if applications are being delayed, why they're being delayed. So I think historically, what I've seen, we have real-time reporting that allows multiple people to address those issues versus if there's a hold on the application, what's going on here. That allows me to reach out to you. That allows me to reach out to Pathway. Having managed a program like this before, that's what made it successful, where we can get you engaged in real time. Now, on the back end, we're talking a year later, and we look at the data points, and only 30% of the money, or very little of the money, went to North Nashville versus, this, we say, minority population. Where did the money actually go in that sense? So we want to make sure, in this case, we're doing it on the front end, and we're doing it in real time, so we can address those issues.
I don't want to put anybody on the spot, but we have a new face back there. And I just want to make sure if you were here with one of the nonprofits that we got to meet you.
No, I'm not. Thank you. My name is John Manson. I'm running for probate judge, and I just came to be political, little politicking, as it were. I just
welcome
wanted
to our committee.
No campaigning
I just
today.
gave you your
Say it
15
again?
seconds.
No campaigning.
I'm just here. I wasn't planning to do this. So
it's a benefit of me not knowing all the ones who were invited. Any other questions from our committee or from our nonprofit partners? Any thing that you want to make sure that our nonprofit partners see? I'll probably send them maybe we can even send them the link to this meeting so they can get some of this information.
And we'll reach out to some more and do follow-up phone calls today, emails. I think we got the list late Friday, and email went out Saturday morning, Saturday afternoon. So we will definitely follow up with them, those who are here, and also those who are not here.
Rhonda?
So would it be possible that the email that's sent out to the nonprofits also be sent out to the committee members? I had a couple of calls this morning. I hadn't seen it, so
great
thank you.
idea.
That'd be great.
All right, well, very good. Thank you for that. Thank you again for our nonprofit partners for coming on very short notice. We appreciate that. Hopefully it was helpful for you and this gives you a little time. We'll move on to looking at the hub survey. Let's see, I sent that out electronically. Does anybody need it? Anybody not able to access it? Again, I wanted to thank Aaron Williams and Ed Buckley and the team. The hub team, so quick, so responsive. The dashboard, I think, is great. They did the weighted averages for me. So what you have, I really think kind of that one page is, I wanted y'all to have the dashboards and you can see some of the different responses. But what we did is basically said, okay, if 1 is the most important, 5 is least important, how many, what's kind of that weighted average of everybody who put a 1 versus a 2 versus a 3? So interestingly, I also looked at the interim report, and the results were not significantly different. Like this is the sheet, this one-page sheet that you have. I started with that and actually had responses as of 1/11 and then responses as of 2/1, and the shifts actually were at the bottom. So I thought that was just something worth commenting on. And so what you see, and I told y'all I would do this, as I went back through all of the resolutions, the recommendations this committee has made, and then as approved by council, and that's in the column that says funding previously allocated. So you can see where the community responded as, the highest importance, and if it's been funded or not, and to how much. And so thank you again for kind of allowing the childcare folks to come in. I knew this is what you would see, sent it out before. We had seen it in the interim. I didn't want to kind of jump ahead of the results, but since we have guests, I like to do our kind of housekeeping at the end. So, so that was obviously kind of that gap that you see as the third most important. And really, when you look at those top ones, 1.82 versus 1.83 versus 1.86, that's all pretty darn close. And so that was definitely an area that I thought was worthy of our first response to the community survey. But I wanted to open it up to your observations and any questions or requests. So, Councilman Sepulveda.
Yes, and thank you to Aaron and the Hub team for getting this together. I did want to point out a couple of things. What I'm glad we kind of doubled the response from the halfway point, so that's great. Wish it could have been more, but having it double was important. I did read through the extra suggestions that we hadn't necessarily categorized for everyone to just quickly rate from 1 to 5. And I did see a lot of patterns as far as free legal services, and legal services I know is being worked on as far as eviction scope, but the other one that I saw that kept coming up was immigration legal services. I saw a lot of transportation, which is something that we hadn't put specifically on here, but transportation kept on coming up, and walkability. So I saw a lot of patterns in there that's not necessarily ranked on this, but I think it's still, I want to make sure that we don't forget those. I read through all of them, and I did see a lot of patterns that we haven't addressed specifically in a category or in previous funding that I think that we should look at in the upcoming meetings, and maybe we could finally vote on implementing a strategic plan, the draft that we had, but changing a couple of things. I don't think that a whole lot has changed from that strategic plan, but there are things that need to be added.
Yeah, no, thank you for that. And I did the same. And the only other thing that I would add, I noticed the immigration services and transportation. There was also a lot for schools. A lot of it said schools and MNPS. And just, I think that's worth pointing out for clarification, that because of the amount of funding that they have received separately, it is not anticipated that these funds would be used for MNPS. It's right around 400, I want to say around $470-ish million amongst their three packages. So we are not leaving them out just to leave them out. Because they had separate funding. So I thought that was worth pointing out also. The other thing that I wanted to mention, and then this may be more of a reminder for maybe folks listening, the original kind of guiding principles and the items that were identified by the administration as things that they had on their radar is what made it to this sheet. So this sheet actually was a bit of the guiding principles and the intended funding. And so it's not a surprise that many of the items on here have been funded because those were the areas identified. So just as Councilwoman Sepulveda said, what we did want to do is identify what did we leave off. And so those were the areas that I think then we can put this together. And if we do want to, more cities have started to file some of their rescue plan documents that are required by Treasury. And the ones that I've seen are much more general. They will, so let's see if I can do this out the top of my head. This is dangerous. But the first category of eligible expenses are public health related. So that could be anything from emergency response to mental health, behavioral health, some of the equipment and needs of our health departments. So that all falls under public health. The second item is addressing negative economic impact through either small business or individuals. 3, I believe, is a subsource of the economic impact. And then, oh, Wade's awesome. She's got this for me. Thank you. And 3 is services to disproportionately impacted communities. 4 is the premium pay. 5 is water and sewer, broadband infrastructure. 6 is revenue placement, and 7 is administrative expenses and other. So a lot of cities just put dollar amounts under one of those 7 categories. That's their plan. They didn't have all the details within the plan. They just said, if we have 200 million, we're going to put 20 million in public health, 40 million in negative economic, they just they divvied it up that way. That's what got approved. And then they went off and did what we're doing to put then they knew kind of what they had in that bucket. So if we want to do something is that something that you want to do along those lines of those general buckets? I mean, we have these now that are a little bit more specific, but what I can do is take each of these line items and put them under one of those, especially with what we've already funded. So I just would, whatever your vision would be. I saw Jose first, and then I'll go to Councilman Gamble. There you go.
See, that just because the way my brain is wired, that resonates with me more than what we've been doing, and in particular, moving forward. Okay. Like one of the things I'm thinking, okay, so we're approaching the halfway point. We're not there yet, of course, but we're approaching halfway point. And so does it merit, after this initial several months, to really do a high-level thinking and carving out an allocation in that way? Because maybe this is just me, it feels to me that maybe that's going to be a better impetus for us kind of really elevating that notion that we've shared several times about the long-term leveraging ability of these funds. And so, it feels like here at the beginning, it was the emergency stuff, the things that we need. But as we get into a rhythm on the second half of the project, maybe that would just looking at a dashboard like that might be more helpful to say, well, look at the different buckets at this high level, and then drill down to really again highlight the notion of what I've said before. I want to look 5 years from now, look back and say, look, this is the legacy that was left from this investment. Yeah. And so that resonates. I will just make one more comment. While I appreciate the fact that we doubled the responses, I just have time. It's certainly disappointing. It's no one's fault, but it's surprising that the response rate is as low as it is. That this effort, this amount of, the importance of these funds, and that we are only able to generate 2,000 responses. It's it's just, again, no one's fault. It's just disappointing.
Thank you. I agree with Jose as far as for the second half, or as we are approaching the second allotment of funds, doing it in that way, doing it in a way where we're figuring out how much, based on data, particularly the survey and then other data points, how much we need to put towards each category and make a recommendation on that, and then, drill down more.
Right. I think when we do that high level, what it will do is it'll just give you kind of a bookmark of the funds to work with. Right. And we continue to drill down to many different, and I think I've sent it before. I know none of you can see it from here, but just visually, if this is the number one category, there's all sorts of different areas within number one. Then you've got number two. There's all sorts of different areas. So we'll place those dollar amounts at the high level, and we might have 5 or 6 different areas under each one that we'll eventually drill down to. But it gives us kind of that ballpark that we're working in within each category.
And one more point. I didn't notice in the categories, a category for support for essential workers or the premium pay that you mentioned, but I did notice it in the written responses that that was a priority. I didn't see that line item though in the list of actual 1 through 5 categories. So I think it's probably important that we add support for essential workers, the workers who have to go to work, are still being exposed with COVID, and now at this time, not getting any administrative support, particularly our Metro employees, aren't getting any administrative support for being out with COVID. And so that's another area that we need to look at and address. And so if we can add a category for that and in support for that from this survey as well.
And I'll share that the idea that it wasn't originally listed in those guiding principles was because of the hazard pay. But again, we put those back together in June before we had Omicron and all of that.
But the hazard pay was restricted mostly to our emergency first responders, our police, fire, and OEM. It really didn't include essential workers. And so having that as a was it Parks Police? Yeah. So including that in this round, I think would be important.
They just don't have as much of the head count as the ones that you mentioned, but.
Thank you.
Yep. Any other questions or thoughts? So that's sorry. That's okay.
So I think it'd be helpful just to see what we've done so far. Yes. So we can see in that pie, okay, we've done 30 million in this first category, and then on.
I agree. I think if we do it in like tranche 1 and tranche 2 of payments, so that if we see a total, I'm not implying this, but even if there's nothing coming from second tranche, by the time you get to the total, we still have a total. So I don't want to separate the 2 payments, but we'll identify it in 2 columns and have a total column.
Yeah, perfect.
Great. Okay. So our next meeting, we will really have kind of part 2 of today. So it will be childcare and our nonprofits again. Is there anything else? I'm also going to ask this committee, one of the things that we need to do is, from a reporting perspective, and we still plan to bring on some consultants. I have to apologize. I didn't send you all our first quarter report, but January 31st, we filed the first report for all of the projects and expenditures of the rescue plan. And I'm going to post that out to our finance website. We're just going to keep all of this very transparent to the public. As of 12/31, we did not have a significant amount of savings. We had, I think it was 72 million that was obligated, through December 31st, but we didn't have a significant amount of savings. That has started to pick up this year. It's just been slow for folks to get things in place, slower than probably expected. But consultants, no, it wasn't savings. It just, they didn't start spending. Spending, yeah. We didn't have as much spending in that calendar year as we expected. So, but things like having the consultants are part of the administrative components that I will tell you. Another reason I'm thrilled, team of 1 went to team of 2. That's a great increase, but it's still not enough to make sure from the grant reporting. It's a really heavy lift on the reporting, and we want to make sure we do it right. We don't want to put Metro at risk upon audit, and so we are going to rely on some outside sources for that, and that's going to fall under administrative expenses. So we do need to approve some administrative expenses. I'll bring you that, so I think we can do that at the next meeting. So we have one thing that we have to do here today, which is a bit of a vote. And then the second thing then we're going to come back to that. When do you all want to meet next? So hold that thought still for a minute. I have to apologize. I did not send out the amendment. Alex, that's my mistake. But let me explain to you all. United Way was awarded the $3 million to assist with rent, mortgage, and utilities. And the idea was that MAC had the HOPE program with the emergency rental assistance funds that were coming directly from the federal government. So we didn't have to do a significant amount of rent relief, rent or mortgage. But MAC was experiencing some folks who were over that 80% limit. So the original award to United Way is to provide that rent and mortgage and utility assistance for individuals who don't qualify for HOPE up to 100% of the average median income. What United Way has experienced now is a few folks under 80% needing mortgage assistance, but the emergency rental program is only for rent. And there aren't any more mortgage funds available through MAC. So I did talk to Dr. Kroom, talk to United Way, and what we wanted to do is actually do an amendment that expands the use of those funds. They're not asking for more funds. They just want to be able, for the mortgage portion only, use it for folks under 80%. Because they've gotten a slower start from that program, the other thing that we talked about is that they think they will have the funds longer than June 30th of 2022. So could we just extend the program now that we're extending the use? And that just seemed to be simple housekeeping, so.
I'm okay with it. Can you add my name to that?
Absolutely.
Please, as a sponsor, thank you.
Alex, so.
Already on the agenda with several sponsors, by the way.
Yes, so we didn't want to late file that, but we actually, consistent with making sure that we can say, does the committee recommend that, or are you opposed to it? So I am going to go ahead and ask for a vote. Is anybody opposed to that extension? Sure. Oh, regular. So.
I move that the amendment that is drawn up be recommended by the committee.
Excellent. Can I get a second? Any other questions? All in favor? I see 6 in favor, 0 against. So thank you for that. We do want to make sure we bring any changes before the committee, so thank you for that. Yeah, all 3 council members sponsor? Thank you. Okay. So then the last item, we can just do March 9th. I mean, that gives everybody plenty of time. That's our next meeting, but we will miss the March 1st. Well, we would miss it anyway, won't we, Alex? Because even if we met in 2 weeks, it's after the filing deadline. So that isn't a barrier. It's just about time to discuss with the nonprofits or give us any other time. So I leave that completely up to y'all. It's your time.
I think the timing of the outreach period is probably going to have to change based on the March 9th meeting.
I think you're right.
We just need to make that clear.
I do agree with that. I think it's going to slip, and we don't want to cut people off. Alex, I'm not sure. We put in the exhibit those dates for like information meetings on March 1st, application April 1st through April 30th. It's part of the exhibit, but I don't know that that makes it part of the contract. If we want to change those dates, do we have to file legislation?
The amendment's part of the contract. So I think we might need to amend.
There isn't a contract yet.
No, I'm saying it would need to be part of that. Like that's what the council's voting on. Is
Yeah.
So that's be incorporated in the resolution.
Okay.
So I'd have to look at it exactly, but we might need to amend it.
Okay, so we may need to just make amendments, in which case we'll bring it back to the committee and we'll file something. So then do we want to just stick with our regular meeting next March 9th? Great. Okay, well, we are officially adjourned today. Oh my gosh, y'all, it's 5:20. Can you believe it? You didn't get your money's worth, Jose? Thank you all very much.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.